Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. And joining us this morning is Dr. Aaron Feinauer, Pharmacy Manager at Covenant Healthcare. So, Dr. Aaron, thank you so much for being here. How are you this morning?
Good. Thanks for having me. You can just call me Aaron.
All right. I just try to, want to be respectful. And it works for that title, of course. So we continue the discussion on the COVID-19 vaccine. So, Aaron, on Monday, the FDA issued full approval of the Pfizer COVID-19 vaccine. There are also those two other vaccines available. So can you share with us a little bit about the COVID-19 vaccine safety and efficacy?
Yeah, so what we've seen now with that full FDA approval is just a confirmation of Pfizer that the vaccine in itself is safe. It continues to be safe for our patients, and it works just similar to Moderna as well, too. They're both mRNA vaccines that help us to identify that spike protein on the coronavirus to help our body fight it. And the J&J vaccine works a little bit differently, but similar idea to that spike protein recognition.
All right. Yeah, that sounds good. Now, Aaron, from the beginning, experts have stated the vaccine is helpful in reducing, hospitalization and the severity of your illness, of course, related to COVID-19. So what has the team at Covenant been seeing lately?
Yeah, so we've been seeing the same thing. So honestly, since the beginning of what we could consider fully vaccinated back in January, when that first group of people had both doses of the vaccine and 2 weeks out, we've only had 4 patients hospitalized that were fully vaccinated, which is remarkable when you think of the total number of patients we have coming through that are testing positive for it. So even here in Saginaw, we see that efficacy very, very high and very good at preventing hospitalizations.
All right, that's good to know, and may help some people who still are on the fence. Now, last week too, the CDC issued more guidance around these vaccine booster shots and additional vaccines, especially for those who are immunocompromised. Can you help explain and maybe clarify some of this information for our viewers? Because I know, like for myself, I'm fully vaccinated. What about my booster shot?
Yeah, absolutely. So the first step is taking care of the immunocompromised, and it was something that we kind of expected because they came right out at the beginning and said we didn't have immunocompromised in our trials, so we don't really know how well the vaccine is going to work for them. And now that we've had enough data for it, we've seen that population doesn't have the same antibody response as a healthy individual. So having that third dose booster for them as soon as they can get it, that 28 days after their second dose at the earliest, is going to help them to produce a higher level of antibodies and a higher level of protection. Now, for us, we're kind of in a different boat. So we know that the antibodies kind of reduce from month over month, and right now it's still showing good protection against hospitalization and death, but we don't know when that line might cross if that antibody level gets too low. So this is really kind of more of an offense against the virus, really, to say, hey, we don't want to get behind on it, so we want to come up with a booster plan for healthy individuals on getting a third dose. So I expect to see more information coming from that in September. The Biden administration's already announced that a booster plan is coming for it. I think we'll have some clear guidance here soon.
All right, and we'll keep an eye out for that as well. So, Aaron, if someone is eligible to still get the vaccine, still on the fence, maybe the FDA approval this week helped, but for those still unsure, what do you want them to know most?
I want them to know it's one of the easiest, simplest things they can do to help protect themselves against the virus. Masking works, the spacing works, but the vaccine itself is the best thing you can possibly do, and it's available just about everywhere, so very easy to go get.
All right, sounds good. Aaron, and where can they get them? Where's the vaccines available right now?
Yeah, any of your local pharmacies for it. So most major retailers have it at walk-in. They don't even need to make an appointment. There's a lot of walk-in clinics. The health department is still putting on events for you as well, too. You could drive down the road probably between your house and work and find 4 or 5 places giving the vaccine.
All right, Aaron, anything else you want to add before we go?
No, just one last thing to say. I appreciate you guys having me back on it, and I'll keep coming back every time you need me to talk about getting the vaccine. It is the best possible way to fight this virus, and really encourage it.
All right, Aaron, appreciate your knowledge and perspective always. So thank you for coming on.
Thanks for having me back.
Of course. And if you would like to have any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.